You might remember this, waiting in line to get a COVID test. A couple of days later, you got your results, but now at-home testing is easier and more efficient. However, those results aren't tracked county-wide, and that's where San Diegan's sewage comes in.
Although not everyone takes a test these days or reports their test, everyone poops.
Rob Knight pioneered wastewater testing for COVID at UC San Diego. It's proven to be an early indicator of viral spread, with detection up to 2 weeks before normal testing. That's because infections first develop in someone's gut. Now that sewage testing is continuing on.
Although there's a general feeling that COVID's over, it could be like the flu, where there's new variants that arise that are much worse than the variants that we have currently. And if you have to set up the program again from scratch, train all the staff and so on, it's very difficult to do that. So as an insurance policy, it's extremely valuable to keep it going.
Knight says the amount of COVID in the wastewater is low right now. In fact, the lowest in over a year. In the past, we've seen summer and winter surges as the virus evolves. Wastewater testing allows researchers to see within a day or two what strain or variant is dominant, something that Knight says is key.
You probably remember the Omicron spike that caught everyone by surprise, and then before that, the Delta spike that caught everyone by surprise. We'd really like there to be no more surprises at this point.
San Diego County Public Health Officer Dr. Wilma Wooten says her office is contracting with UCSD to continue wastewater testing for at least 5 more years.
I personally view wastewater testing as the future of surveillance in public health.
Wooten says the county is also working with partners to look for other diseases in wastewater, including the flu, norovirus, and RSV.
That's the beauty of wastewater testing, is the early detection of viruses.
Right now, samples are taken from 3 wastewater treatment plants twice a week. On UCSD's campus, they have their own testing process. It examines samples taken nearly every day from more than 100 locations. Knight says research is underway to see how wastewater data can be used in other ways too.
This idea that you can not only monitor health right now, but use it to predict the future.
Matt Hoffman, KPBS News.